181. Medical control has ordered you to administer 1 tube of oral glucose to your patient suspected of having hypoglycemia. Immediately after receiving this order, you should A. Document the order on the pre-hospital care report. B. Administer the medication and reassess the patient. C. Ask medical control to repeat the order word for word. D. Repeat the order back to medical control word for word. The answer is D. Repeat the order back to medical control word for word. 182. While caring for a critically injured patient, you remove blood-soaked clothing in order to manage injuries. You should dispose of the clothing by A. Leaving it at the scene. B. Leaving it at the hospital. C. Placing it in a biohazard bag. D. Placing it in the ambulance trash can. The answer is C. Placing it in a biohazard bag. 183. Which of the following statements regarding the head tilt chin lift maneuver is most correct? A. It can only be used in conjunction with an oropharyngeal airway. B. It can only be used temporarily and must be replaced by an airway adjunct. C. It should be used on all unresponsive patients that you encounter. D. It is the technique of choice for patients with potential spinal injury. The answer is B. It can only be used temporarily and must be replaced by an airway adjunct. 184. In which of the following situations should the jaw thrust maneuver be used? A. In any patient who is in cardiac arrest. B. In a patient with apnea with no signs of trauma. C. In a patient who is in need of frequent suctioning. D. When the mechanism of injury is unclear. The answer is D. When the mechanism of injury is unclear. 185. An elderly man is found lying unresponsive next to his bed. The patient's wife did not witness the event that caused the unconsciousness. You should first A. Assess the patient's respirations. B. Apply 100% supplemental oxygen. C. Tilt the head back and lift up the chin. D. Grasp the angles of the lower jaw and lift. The answer is D. Grasp the angles of the lower jaw and lift. 186. A patient has severe facial injuries, inadequate breathing, and copious secretions coming from the mouth. How should this situation be managed? A. Alternate suctioning for 15 seconds and ventilations for 2 minutes. B. Provide artificial ventilations and suction for 30 seconds as needed. C. Turn the patient to the side and provide oral suctioning continuously. D. Insert an oropharyngeal airway and suction until the secretions clear. The answer is A. Alternate suctioning for 15 seconds and ventilations for 2 minutes. 187. When ventilating an apneic adult patient with a bag valve mask device, you must make sure that A. An airway adjunct has been inserted. B. You are positioned alongside the patient. C. Ventilations occur at a rate of 20 breaths/min. D. The pop-off valve on the BDM device remains open. The answer is A. An airway adjunct has been inserted. 188. Which of the following processes occurs during inhalation? A. The intercostal muscles and diaphragm both contract. B. The intercostal muscles relax and the diaphragm descends. C. The diaphragm contracts and the intercostal muscles relax. D. The diaphragm descends and the intercostal muscles relax. The answer is A. The intercostal muscles and diaphragm both contract. 189. Which of the following processes occurs during cellular/capillary gas exchange? A. The cells give up oxygen to the capillaries. B. The cells receive carbon dioxide from the capillaries. C. The capillaries give up oxygen to the cells. D. The capillaries give up carbon dioxide to the cells. The answer is C. The capillaries give up oxygen to the cells. 190. What is the preferred method for initially providing artificial ventilations to a patient with apnea? A. Flow-restricted, oxygen-powered ventilation device. B. Mouth-to-mask technique with supplemental oxygen. C. One-person bag valve mask technique with 100% oxygen. D. Two-person bag valve mask technique with 100% oxygen. The answer is B. Mouth-to-mask technique with supplemental oxygen. 191. A reduced tidal volume would most likely occur from A. Flaring of the nostrils. B. Accessory muscle use. C. Unequal chest expansion. D. Increased minute volume. The answer is C. Unequal chest expansion. 192. Which of the following patients is exhibiting signs of inadequate breathing? A. A 41-year-old woman with shallow respirations of 20 breaths/min. B. A 60-year-old woman with bilaterally equal breath sounds. C. A 30-year-old man with respirations of 18 breaths/min and equal breath sounds. D. A 50-year-old man with respirations of 12 breaths/min and pink, dry skin. The answer is A. A 41-year-old woman with shallow respirations of 20 breaths/min. 193. Snoring respirations in an unresponsive patient most likely are the result of A. Foreign body airway obstruction. B. Upper airway obstruction by the tongue. C. Collapse of the trachea during breathing. D. Swelling of the larynx and surrounding structures. The answer is B. Upper airway obstruction by the tongue. 194. In an unresponsive patient who has not sustained trauma, how are respirations of 16 breaths/min with good chest expansion most appropriately managed? A. Suctioning as needed and artificial ventilations. B. The jaw thrust maneuver and frequent suctioning. C. An airway adjunct and oxygen via non-rebreathing mask. D. An airway adjunct and ventilations with a BVM device. The answer is C. An airway adjunct and oxygen via non-rebreathing mask. 195. Initial management of an unconscious adult patient who fell 15 feet from a tree includes A. Performing a jaw thrust. B. Performing a head tilt chin lift maneuver. C. Providing oxygen or artificial ventilations. D. Assessing the rate and quality of breathing. The answer is A. Performing a jaw thrust. 196. What should your first action be when treating a 40-year-old man with rapid respirations? A. Apply 100% supplemental oxygen. B. Insert an airway adjunct as needed. C. Assess the regularity and quality of breathing. D. Initiate artificial ventilations with a pocket mask. The answer is C. Assess the regularity and quality of breathing. 197. In what position would you expect a patient with severe dyspnea to be in? A. Prone. B. Supine. C. Fowler's. D. Lateral recumbent. The answer is C. Fowler's. 198. Which of the following listings of techniques and devices represents the correct order of preference for providing artificial ventilation? A. A pocket mask, one-person BVM, two-person BVM, flow-restricted oxygen-powered ventilation device. B. Pocket mask, two-person BVM, flow-restricted oxygen-powered ventilation device, one-person BVM. C. One-person BVM, pocket mask, 2=person BVM, flow-restricted oxygen-powered ventilation device. D. Two-person BVM, one-person BVM, flow-restricted oxygen-powered ventilation device, pocket mask. The answer is B. Pocket mask, two-person BVM, flow-restricted oxygen-powered ventilation device, one-person BVM. 199. Tidal volume is best defined as the A. Volume of air inhaled in a single breath. B. Volume of air that remains in the upper airway. C. Total volume of air that the lungs are capable of holding. D. Volume of air moved in and out of the lungs each minute. The answer is A. Volume of air inhaled in a single breath. 200. You would most likely encounter agonal respirations in which of the following patients? A hypoxic patient who is in the early phase of compensation. B. A severely hypoxic patient who is in the later stages of compensation. C. A patient who is in the midst of complete respiratory failure. D. A semi-conscious patient whose tongue is occluding the airway. The answer is C. A patient who is in the midst of complete respiratory failure.